I'm here with Susan Stewart, founder and principal of the leading guardianship and geriatric care management firm in Albuquerque, Decisions in Care. Today we're talking about how overwhelming it is to care for a loved one and what to consider when you are the person responsible for caring for your aging parents or a friend. Susan, recently my friend's father experienced a health setback, and all of a sudden she was thrust into overseeing his recovery, his rehabilitative care, and his transition back home. She was overwhelmed. When put in this situation, where do you even begin?
It's important to consider the person's strengths. We want the individual to continue to function as well on their own as possible, and the supports that are to be added should only be those areas that that individual is needing assistance with.
How do you know where to start?
This can be very challenging. As the caregiver, it's important to educate yourself on the options of care that are available to you. This can consist of a whole array of services, including home care, placement in a facility, and other care options as well.
And what if the person needing care doesn't want help?
It is important to respect the individual's wishes and try to consider how they feel. Get them to talk about their hopes, and additionally to talk about what their worries are, what concerns them. You're going to want to not overstep their wishes unless there are health and safety concerns.
And how can the personal caregiver make sure they don't get burned out?
This is critical for the caregiver. It's important that they make a plan to take breaks on a regular basis. I was recently involved with an individual who is providing care for his mother, and we allowed him to be able to take a break for a week, even though he was going to be in town. Having somebody as a backup so that if something happened to his mother, that he would be able to just take time to take care of himself. It's also important to ask for help, and it's important to identify what your specific needs are. As a caregiver, it can be totally overwhelming. I have a very good friend that when she was in this situation, if somebody called on the phone and asked, "What can I do to help you? Can I do anything to help you?" she would, instead of say, "No, I'm doing okay," she kept a list right next to her telephone, and she said, "Let me get out that list and I can tell you how you can help me. Do you have time to run this errand for me? A batch of home-baked cookies sure would be good." Or, you know, "Could Sam come over and mow my lawn?" And so having a list of things that you either don't have time to do or that you aren't able to do on your own if your spouse is ill can be very beneficial. Respite is so critical to the caregiver, and it can really help for depression to be decreased, for the caregiver's health to be improved, as well as longevity. Unfortunately, too often caregivers will not ask for help when they need it, and this leads to them too often passing away prior to the person that they're providing the care to.
What individualized professional assistance is available to caregivers?
A caregiver may want to consider hiring a professional geriatric care manager when the problems that they're facing are larger and more complex than they're able to comfortably manage. They might have other demands and responsibilities that are too great for them to take on this added role. Sometimes the caregiver is unable to provide the necessary level of supervision, and the problem oftentimes requires more attention and skill than what the caregiver is able to effectively provide.
What does a care manager assist with?
A care manager can assist with a variety of different areas. They can provide information about housing options that are available, as well as funding services for those housing options. They can provide information about financial benefits and services that are available in the community. Oftentimes, a care manager can attend medical appointments, they can advocate, they can ask questions if the family member lives out of state or is working and can't attend the medical appointment, and can ensure that effective follow-up occurs.
How can I find a care manager?
An individual can find a care manager through the National Association of Professional Geriatric Care Managers at caremanager.org.